Hello, I'm Jason Peterson, Director for the Department of Environmental Health and Safety, Chair of the Environment of Care Committee, and appointed Safety Officer for UC San Diego Health. I'd like to take a few moments of your time to go over construction safety while you work here at UC San Diego Health. We have patients who are put into our care who wouldn't be able to save themselves during an emergency. Therefore, it's critically important that we manage risks such as fire, hazardous materials, noise, dust, etc. during and throughout all construction projects. At UC San Diego Health, we thrive to establish a culture of safety excellence. Safety is all about people. For a hospital construction project, patient safety will always come first. In order to address concerns of patient safety, contractors must ensure that each part of their project plan keeps patient safety in mind at all times. One of the best ways to do this is to plan every hospital construction project in as much detail and as far in advance as possible. This not only gives hospital staff the chance to ask questions and point out any potential roadblocks, but also allows time to communicate issues within the hospital, from moving patients, if necessary, to making backup plans for the construction time period. The other integral and vitally important part of patient safety is infection control. That is, keeping patients, staff, and visitors safe from dust, debris, and other potentially hazardous particulates that are stirred up by construction projects. Dust containment measures, including negative air equipment and HEPA filtration, are necessary and should be used to keep dust particles out of occupied areas of the hospital. Remember, safety is everyone's responsibility, regardless of your role. With your help, we can ensure a safe, healing environment for our patients. Thank you for doing your part in allowing us to fulfill our mission of delivering outstanding patient care throughout our commitment to the community, inspired teaching, and groundbreaking research.
Hospital construction is unique to the construction industry in that a vast majority of addition and renovation projects are done in fully functioning facilities. Whereas an office building, parking garage, or even a home may be able to shut down for weeks or months while construction is being completed, this is virtually impossible for hospitals due to patient needs. Because of this, hospital contractors need to be trained in what it means to work in a hospital, namely, building their construction plans with patient needs as a top priority. It is UC San Diego Health's policy that accident prevention be a prime concern of all employees. This includes the safety and well-being of our employees, subcontractors, and customers, as well as the prevention of wasteful, inefficient operations and damage to property and equipment. As you know, there are a wide variety of safety issues presented to a construction worker in their job. Doing that work in a hospital magnifies those safety risks on many, many levels. We have patients who are put into our care who can't always save themselves during an emergency. Therefore, it is critically important that we manage fire, hazardous materials, noise, dust, and etc. during a construction project. First off, for your own well-being, we'd like you to know about our emergency phone number that we use within our facilities. If you have an emergency, whether it's medical, fire, a chemical spill, you can call 6111 and get our internal hospital resources, as well as outside fire or police to respond. If you use a cell phone, dial 619-543-6111 to get emergency assistance. The Orange Emergency Codes Card. In the hospital, we use a wide variety of codes to designate the emergency type that's occurring. And these emergencies could be from an abducted child, a medical emergency, a security incident, a fire, or a community-wide disaster. We don't expect you to memorize all these codes, but you'll be getting a card to go along with your photo ID. This card will have a list of all the codes, a description of what's occurring should you hear that code going on. It also lists the emergency numbers. Always wear your photo ID on your chest, along with your orange emergency codes card so that you can have them at easy reference. An ounce of prevention is worth a pound of cure in many instances, but particularly for fire prevention in a hospital. Because we have patients undergoing surgery, delivering babies, or are just bedridden and cannot get up and assist themselves, we have to make sure that we have no fires in our facility. Evacuating them out is extremely difficult and complicated. To manage our fire risks, we institute interim life safety measures, or ILSMs. The first one of those is containing the construction area, either with a visqueen barrier or a hard wall barrier, depending on the type of construction going on. This provides a fire and smoke type barrier around the construction. The second issue is maintaining clean, safe areas within the construction site. On a daily basis, you need to remove your trash. All trash needs to be covered when it leaves the construction area. We want to keep combustible materials to an absolute minimum. If there's nothing to burn, it's very difficult for a fire to get started. Secondly, we want to maintain all the exits. For your own well-being, we want to document on a daily basis that you can safely get out of the construction site. In many instances, these evacuation routes are also there as an emergency exit for our staff and patients should a fire occur. So always maintain these exit ways. In order for a fire to start, we have to have a heat source. So it's critically important that we manage all of the heat generating activities. Any hot work must have a permit issued by our facility, and when that hot work is occurring, there must be a fire extinguisher on site and a fire watch in place at all times. In addition to hot work, fire watches must occur if we ever take down the fire extinguishing system or the fire alarm system. If that's going to occur, you must give advance notice to our facility so we can schedule that outage and make sure the fire watch is present. Fire procedures. Should a fire occur, we initiate a race response throughout our facility. This is a protocol that all of our staff are taught and implement when we should have a disaster or are conducting a drill. So we expect you to follow the same protocol. Ideally, all 4 of these actions should occur simultaneously. If you discover a fire, you're the one in charge. Delegate each of these activities to one of your coworkers. If you're the only one there, then do them in this sequence. R. Rescue. If someone is in danger and has been injured, get them out of the way of the fire any way you can. Drag them away from immediate risk of the flames, then you want to activate the alarm. A. Alarm. You want to make sure the fire department's notified and everyone else in the building is notified, and this involves 2 steps. Pulling the closest fire alarm pull station and calling the emergency number 6111. You can give them details to the location, the type of fire, the extent of the fire, are they injured, and any other details. This will tailor the response from our fire department and our internal response team. It will also help you get the people and appropriate resources you need more quickly. C. Contain. Then you want to confine the fire. Make sure all the doors are closed around the area so that we minimize the risk of fire or smoke spreading into an adjacent area. E. Extinguish. Then lastly, if it's safe to do so, get an extinguisher and try to put that fire out. If you are at all uncomfortable with that protocol, or it's not safe to do so, get out of the immediate area and keep the doors closed until the firefighters are on the scene. If you happen to hear a fire alarm activated, stop all of your work and thoroughly inspect your area. Check your area for smoke and fire. Check every smoke detector in the area to verify that you haven't accidentally set it off due to dust or some other method, because we want to get the fire system back online working properly should we have a false alarm. Anytime the alarms are going off, you must always stay out of the elevator and listen for instructions. Evacuate if necessary. In the inpatient setting, where we have patients housed overnight, we use a defend in place method. so we do not automatically evacuate the building. We move to a safe area adjacent to the fire or on the other side of the fire and smoke containment walls. If you are in an outpatient care building or an office building while you're working when the alarm goes off, we will evacuate at that point. Make sure you know where your fire alarm pull stations are and you always have clear access to them. And you know the location of all your fire extinguishers and can get to them quickly. It's imperative that safety equipment is always quickly available to you in an emergency. You shouldn't have to move ladders or equipment to get to them. In addition, any hazardous materials need to be stored properly. All gas cylinders must be secured. Flammable materials kept to an absolute minimum when they are in our facility. And to prevent false alarms, we need to coordinate the deactivation of our smoke detectors. It's easy to set them off with a minimum amount of dust, steam, or materials. So, in coordination with our facilities engineering, through your project manager and inspector of record, we want to isolate these detectors while you're working. Hazardous materials can also present a wide variety of safety issues for yourself and our patients. So all material brought into our facility must be reviewed by the EH&S office. When you use them, you need to store them, handle them, and dispose of them according to the safety data sheet. You must have all of these safety data sheets on hand and be familiar with how to safely handle all of these products. If you have a spill, you need to isolate, contain it, and report it to your supervisor and our EH&S office. Never allow material to go down the drain, either as a disposal method or through a spill. You need to get it contained quickly. It is required that you always follow all safety protocols. Your company's safety plan needs to address all of the Cal/OSHA compliance issues related to your job. Whether it's working on heights at the top of our building, going into confined spaces, or working on energized systems, you must always lock out and tag out so that you are safe at all times. Your lockout, tag-out process must be in conjunction with our facilities engineering, and these things must be scheduled in advance through the project manager and/or the inspector of record. As mentioned previously, hazardous materials must be managed appropriately. You have to have appropriate personal protective equipment and material safety data sheets available so that you know how to use, store, and dispose of those properly. Environmental compliance regulations. In addition, we need to comply with all environmental compliance regulations. Our stormwater drains must be protected at all times from accidental contamination from chemicals, dirt, or runoff from the street. Your company has to have a stormwater protection runoff compliance plan. Our facilities engineering and maintenance department is here 24 hours a day, 7 days a week, and can be reached through their emergency numbers. Smoking policy. Our facility is a completely non-smoking facility anywhere inside or outside of the buildings. Never smoke while you're in a construction site. Facilities engineering. Our facilities engineering and maintenance department is here 24 hours a day, 7 days a week, and can be reached at these emergency numbers. For Hillcrest, extension 36454, La Jolla 76400. From a cell phone, Hillcrest 619-543-6454. La Jolla from a cell phone 858-657-6400. If you should have a water leak, plumbing leak, exposed wires, give them a call. They will respond immediately to help you isolate that system. System shutdowns. Do not work on any live utility systems. Do not work on any live energized electrical system, pressurized gas system, or other utility system without first coordinating a shutdown with our facilities engineering. They are the only ones designated to isolate these systems. Lastly, if you find any unsafe conditions, we want them addressed immediately. Let your supervisor know. Have them contact our office, the EH&S office, at extension 77166, if it is something that the medical center needs to address. Our environmental health personnel, as well as the infection control personnel, will be through the construction site on a regular basis looking for safety issues and also are available to answer any questions or address any needs you may have. Infection control. Any integral part of patient safety is infection control, which starts with keeping current patients as well as staff and visitors from dust, debris, and potentially hazardous fungal spores that are stirred by construction projects. Our policies contain the regulatory guidelines to minimize and control dirt, dust, and debris from entering any patient environment. This policy specifies the administrative and supervisory requirements, procedures, conditions, and responsibilities necessary for coordination of new construction, renovation, and maintenance projects, including, but not limited to, the administration and supervisory personnel, planning meetings, progress meetings, pre-construction conferences, daily logs, special reports, contingency plans, notifications to others at the job site, and scheduling of access that governs these activities. The reasons for reviewing dust control and contamination in a healthcare environment during construction, renovation, remodel, maintenance, and water remediation is to identify any potential problems associated with those activities. Dust containment measures, including negative air machines and HEPA filtration, should be taken in order to keep debris out of the occupied areas of the hospital. We can greatly alleviate the chances of infection or other dangers being transmitted to the patients or staff of our hospital by having a good dust control and containment program. Please make sure you're familiar with these processes. Examples of containment breaches include rips, tears, holes, broken zippers, unzipped containments, untaped sections of edges, loosening tape, falling plastic, unattended open ceiling tiles and pods, or anything that indicates that the barrier is not intact. All contractors and employees are responsible for maintaining all of those breaches and fixing them immediately. The safety department or the infection control prevention department can shut down any project if any of these safety measures are breached. Issues with negative air and HEPA filtration are also a concern of a breach of dust control and containment. Consult with facilities engineering on air handling issues. Also listed is the Infection Control Risk Assessment, or ICRA, that everyone is required to fill out regardless of classification. As you can see in this slide, the phone numbers accessible for 24-hour coverage need to be noted on all ICRAs regardless of classification. This ICRA represents the policies and procedures to prevent any infection control issues during construction, renovation, or remodel within UC San Diego Health. The second sheet of the ICRA, which is the Infection Control Risk Assessment, is the matrix by which construction activity type, the risk level, and the construction classification are determined. Your compliance with the use of personal protective equipment and the dust control and containment activities protects you as well as the patients from exposure to microorganisms that cause illness and death. Each contractor must have a safety plan, which can be presented upon request, and all contractor personnel working on site must have reviewed the UC San Diego Medical Center's safety video prior to commencing work, which is what this video represents. This safety plan must include the fire response information, infection control risk assessment information, and the original signed infection control risk assessment for each job, and must be posted at the job site. All personnel must wear a UC San Diego Health ID badge in a visible location on their chest at all times, and no one is allowed to work in the hospital without a badge, with no exceptions. There needs to be appropriate covering for every work area. Working in operating rooms requires scrubs and possibly booties to cover your shoes and/or a bunny suit. If you are unsure of these requirements, check with the planner or the inspector of record. There needs to be a designated path of travel to and from the job site. Service elevators are a path of travel for all contractor personnel unless otherwise specified by the university. All elevators used for the transportation of materials should be checked prior to exiting and cleaned as necessary by the contractor. Air vents in construction areas must be sealed. Sections of ductwork stored on site must be sealed at both ends. Contractors may be questioned at any time by hospital staff or agency surveyors regarding the dust control and containment policies and any other procedures and policies around construction and renovation at UC San Diego Medical Center. This is an example of an infection control policy and procedure around dust control and containment policy 913.1. Please be familiar with all the components of this policy and procedure prior to any work at UC San Diego Medical Center. Protect yourself with good hand hygiene by using alcohol hand gel or soap and water. These are both approved methods to prevent the transmission of disease. Check with the staff before entering any room with these colored signs posted. Wear personal protective equipment as needed: gowns, gloves, masks, and goggles. The red sign indicates airborne precautions and negative pressure is required, along with an N95 TB mask. The orange sign represents the enhanced contact precaution, which is posted outside the door for patients with Clostridium difficile or C. diff infection. Whenever possible, patients with C. diff will have a single room or share a room with someone else who has C. diff. Healthcare providers will put on gloves and wear a gown over their clothing while taking care of patients with C. diff. The yellow sign represents droplet precautions. In order to go into that room, you need to wear a regular surgical mask. The green sign is contact precautions. Prior to entering the room, you must wear a gown and gloves at minimum. If you have any questions, please refer to the staff on that unit. Infection prevention is on call 24/7 for any contact. You can reach infection prevention at 619-471-9045. Remember, infection prevention is everyone's responsibility. Please do not come to work if you are sick or feeling ill. Thank you for your time. We welcome you to UC San Diego Health and look forward to you having a safe and productive work time while you're here.